All right, Viva Lifers. This is Dr. Kelly OMD, and it is Monday night at 7:30 p.m. Eastern Time, which means this is Ask Dr. Kelly OMD and guests. Tonight, we have a superstar, an icon in internal medicine who is an amazing person, an amazing physician, and just totally well-rounded about how we can think about stress and how we can manage our stress. So, Dr. Gregory, tell us a little bit more about yourself and then let us know the top 3 things you want us to understand about your talk today.
So I am Alani Gregory. I am based in Washington, D.C. As Dr. Kellyo said, I'm a primary care doctor and I take care of adults 18 and up. And one of the things I also really am passionate about is leadership. So I'm a physician leader. I work specifically within the health equity space and also within diversity, equity, and inclusion. So these types of things where we're teaching people about their health and also making sure that people who may not always have access to the great webinars and all of the different types of healthcare education have access make me really excited. So I'm really honored to be on this webinar with you today.
Well, thank you so much. I'll let you all know we met at something called Black Health Connect just a few months ago, and we hit it off immediately. So she has been so gracious to give her time to us, and I'm so excited because when I tell you she's an icon, she's an icon. Dr. Gregory, go ahead and take us away.
So the topic today is managing the swirl. And specifically, I'm going to talk about how to power up and thrive during times of stress. I'm sure we're all busy people, and so stress is not something that's foreign to us. So what is the swirl? So the swirl is something that my very dear friend Oprah, I'm kidding, calls the flux and constant change and responsibilities in our lives, both positive things and negative things. And sometimes the swirl of life can lead to us having a stress reaction, especially if the majority of things end up being negative or end up weighing on us. And so today I want to talk a little bit about the impact of stressors on our body, both our mental and physical health, but also arm you with 4 tips at the end to help you power up and thrive amidst the swirl. So what's causing us stress? This list is probably not foreign to anyone. So the big things that's causing us stress based on a recent survey is the economy and money. But the other things that's causing us stress is global conflict, discrimination, our relationships, our personal safety, our family responsibilities, our physical and mental health, and of course, politics. So this survey was really startling to me. The survey that looked at stress in America found that 33% of adults reported that most days they were completely overwhelmed by their stress. That means probably a third of you in this room are feeling overwhelmed by stress. And another 43% of adults reported that their stress levels kept piling up. So that means that they didn't really see an end to this degree of rising stress. That's really concerning. And we also know that there's disparities in stress exposure. And as a health equity practitioner, I'm always interested in where the disparities lie. So this recent study showed that adults with disabilities, LGBTQIA adults, and Black and Hispanic adults were more likely to note that discrimination was a significant stressor in their lives. Women, probably not to much of our surprises, reported a higher level of stress than men, and individuals of low socioeconomic status reported having more stress exposure. Additionally, Black Americans and Hispanic Americans also reported having higher levels of stress exposure. So how does stress manifest? And you might feel stress right now as I talk about stress, and you might start to feel your muscles tensing and feeling a little bit of chest discomfort. So these are small things that sometimes become larger things that signal to our bodies that we're having stress. Other things like stomach upset, loss of sex drive, fatigue, all of these are physical manifestations of stress. And again, you don't have to say, I feel stress to have the physical manifestations. There's also mental manifestation. So you can feel sadness or depression. You can experience restlessness. You might feel anxious. You might feel really overwhelmed by everything, even by the smallest things. And oftentimes you may snap at people and feel irritable or angry. And so I probably made you feel stressed. I kind of feel stressed now talking about stress. So I want to leave you with some tips, and we'll chat a little bit more about these during the discussion. But I want to leave you with 4 practical, very practical tips to power up and thrive. But since I probably just stressed y'all out, I want us to take some cleansing breaths so we can recenter and get ready to receive this information. So if you are willing, you can join me with taking a deep inhale and exhale. Again, a deep inhale and exhale. All right, let's dive in. So the first tip that I want to share with you is pausing and reflecting. It's really important for us to take stock of how we're feeling and what we're doing to care for ourselves. And this seems really easy. Again, I told you I'm going to share with you practical tips, but it's something that we often overlook. We're just going, and we're not pausing and reflecting on how we're feeling. And so I encourage you to ask yourself these questions. How am I feeling? How am I managing my stress? What's contributing to my stress? What helps to relieve my stress? What's worked in the past for me? You might want to hold on to those things. And what's not worked in the past for me? You might want to leave those things behind. And then you also want to think about your degree of motivation for any type of lifestyle change, stress management being one of them. Your degree of motivation helps to determine your success. So really think about, where am I in the motivation, in my degree of motivation, and how can I get closer to being motivated? So again, pausing and reflecting, this can happen by journaling, or this can even happen by just thinking about it, silently as you sit alone. So once you've reflected on these challenges, I want you to set a SMART goal, maybe one, maybe two. And you may have heard about the SMART goal mnemonic. It's really a good way to develop a goal and make sure that it's something that you can act on and something that is really well thought out. So SMART goal stands for S, specific. What exactly are you trying to achieve? Measurable. How will you know that you've achieved this? A is attainable or achievable. Is it really in your power to achieve this? You want to be practical here. And then realistic. Is it realistic that you'll achieve this? Is this something that's really within the sphere of your control? You only want to set goals that's in the sphere of your control. And then time bound. When do you want to achieve it by? This helps to create some parameters for you. So here are some general categories, and any SMART goal that you create is going to be really specific to you, but these are some things you might think about. So for some people, if they exercise, they feel less stressed. So you might set an exercise goal, or you might want to do a mindfulness practice similar to the breathing exercise we just did. Or you may have been thinking about making a therapy appointment. So you might go ahead and finally set a time and place to make that therapy appointment. If the media is something that's really stressing you out, which a lot of Americans are experiencing, you might decide how you're going to disconnect from media. And if the Sunday scaries really get you scared, you might think about how might you manage your deadlines, how might you manage email when you get to work. All right, this is just an example of actually a SMART goal that one of my patients recently came up with. So I will reduce my stress by meditating using the Headspace app for 30 minutes 2 times per week for 1 month. Again, there's a lot of specificity here. And then the third tip is finding an accountability partner. This can be a real life person, like a family member or a healthcare provider. I serve as the accountability partner for many of my patients. Or it might be a habit tracker app. I personally like the Habit app. And again, we all know it's really easy to set a goal. It's harder to maintain that goal. And so I encourage you to find somebody who's going to coach you on and support you and keep you on track. And then the fourth one, which seems really simple, but is really hard, is giving yourself grace. As you set a goal, you might not be perfect when it comes to setting the goal or trying to achieve the goal. And sometimes as we set goals, we strive for perfection, and that can even get in the way of us making small incremental changes that really help us to be able to better manage our stress. So give yourself and others grace, because we're all trying to do our best here. And so the 4 tips I'm going to leave you with is pause and reflect. Take your time to take stock of where you are and where you want to be. Set a SMART goal, a goal that's specific, measurable, attainable, relevant, and time-bound. 3, find an accountability partner. And 4, give yourself and others grace. And if you're interested in setting a goal, which I encourage you to do around stress management, you can take out your phone and scan this QR code. And there's a worksheet that I've created to help you help prompt you in how to create a SMART goal that's going to better help you manage your stress.
Love it, love it, love it. So first of all, thank you, thank you, thank you, because all you're doing is reiterating what the Viva Life Health program offers to our clients each and every day. So, and everything that you said there, we always talk about the meditating, the journaling, the exercise, optimizing our nutrition and our sleep, and it will help reduce all of these things that we are being stressed out about. So I'm so happy to have you on here, just continuing to reiterate that. I think your QR code with the SMART goals, I think that is absolutely perfect, because even when I'm trying to, create these SMART goals, I can do okay, this is a goal, this is
Mhm.
what it looked like, but how do I measure this? And, is this realistic? Because I think that everything is possible. So I have to create like these invisible boundaries for myself to be able to, take things step by step. So that is so amazing and absolutely wonderful as well. I do want to ask a couple of things, because can you talk to us maybe about the top couple of inequities that you see in regards to what you just spoke about, as far as the risks and that we are exposed to?
Yeah. So, in general, so there's still a lot of work being done on figuring out the inequities with stress. As you can imagine, there's so many different factors that factor into stress. But one of the things that we tend to see is that individuals who are exposed to higher levels of stress, and again, they tend to be individuals from lower socioeconomic status, tend to have things like increased rates of cardiovascular disease, higher rates of cancer. And again, we can't say the direct link, but we think a lot of it has to do with the environment. So for example, if you are in a lower socioeconomic environment, you may not have access to fresh fruits and vegetables, so then you then make less healthy choices, and when you make less healthy choices, that puts you at risk for things like heart disease, high blood pressure, diabetes. And so that's one of the big places that we see stress have a correlation or a connection to health, is with higher rates of cardiovascular disease. The other one is substance use. And so you can imagine that people who are exposed to higher rates of violence, intimate partner violence, particularly for Black women, that we might find that these individuals are more likely to use substances. And that could be both from an exposure standpoint, but from a coping standpoint. And so Viva Life and your program is an outlet for people to learn about how to cope in a better way, in a healthier way. And so that those are two big areas that we think about: substance use and heart health.
Absolutely. And as you know, I'm an OBGYN, everybody. So I'm always thinking about women's health in particular. So whether, the decades of, when we start our periods, we tend to start our periods earlier. When we, when we go through pregnancy, we tend to have unfortunate outcomes that occur with that pregnancy. So whether we're delivering our babies early, or we're having, infections, excessive blood loss, complications with delivery, or even fetal death, a lot of times is associated with these stressors, to include racism and discrimination that's associated with that as well. So the research is being done, and it's being sent out, and we're bringing it forth here on the Ask Dr. Kelly OMD as well. So the other thing about stress, and people talk about this a lot, and it's a very sensitive subject: weight. Can you kind of touch on weight gain, and inability to lose weight, and sometimes people lose a lot of weight associated with stress? Can you touch on
Yeah.
that?
Sure. So there's, again, many different sort of pathways to how stress might impact weight gain. So one, again, is just choices. So when you're in a high intensity, stressful environment, you might be less likely, I should say, to make healthy choices. And again, when you make less healthy choices, you might be more likely to gain weight. But we also know that there's an inflammatory type response that might happen when you're exposed to stress. And that type of inflammatory response might be linked to, again, not just things like cardiovascular disease, et cetera, but might be linked to how you may or may not actually be able to lose weight. So you're kind of in a hyper-inflamed state. And so that's why when I think about setting health goals, particularly weight loss goals with my patients, I not only talk to them about setting dietary and exercise goals, but a lifestyle goal. And I can tell you 9 times out of 10, the lifestyle goal that people are setting is around stress, because we know that if you are stressed, there's no way you can fully focus on losing weight. making healthy choices, going to sleep on time so that you can get up and have regular scheduled meals, those sorts of things. So all of this is kind of an interplay. When you're stressed, it really makes it hard for you to lead a healthy lifestyle.
Now, considering that you said women carry more stress than men do, and considering that I believe everybody on the line right now, do you have anything that, we talked about setting those SMART goals, but how do we, number one, get started, right? So a lot of times people are hesitant to get started. And then once we achieve that goal, how do we sustain it? I mean, because I'm telling you, January through, and I was just looking at this, January till about April, May. So starting from the time when, the first of the year, when everybody go ahead and, puts their goals together. But I tell you, by Memorial Day, once Memorial Day starts and all the parties start, that's a whole story.
It's a whole different story. And I'm guilty too, as somebody who's leading, who's seeing patients, I have stress too. And so for me, it's really important. This is an important topic to hear myself as well. But in terms of setting, how do we get started and how do we maintain? Because the maintaining is actually the hardest part. So getting started, again, I would encourage you to think about, where are you on your motivation scale? Are you kind of kicking this stress under the rug and you don't want to deal with it? Are you here at this webinar because you are ready and excited to start managing your stress better? So think about where you are on the motivation scale. And if you're not as motivated, you need to think about how you might get motivated. Maybe you need to talk to a therapist. Maybe you're feeling anxious or down. So thinking about how you might manage your stress isn't really at your forefront. So thinking about how you might get motivated. But once you're motivated, you set your goal, you use the SMART goal worksheet, and you're kind of developing a habit. How do you sustain? And so this is where I encourage you to be a part of groups like this, to find an accountability partner who helps you stay on track. And again, some people don't like telling people their business, but sometimes it's helpful to have somebody who might be going through the same exact thing to work with you on maintaining. And then remembering that if you don't do so well, Memorial Day comes around and you're like, oh man, I have not been doing what I'm supposed to do, it's okay. Reassess, pause again, reflect what's not working. Is it that you actually chose the wrong goal? Is it that this goal is really not attainable and you kind of, set your eyes a little too far ahead? And then you might want to come back, set some baby steps, make it a habit again, and then try again to maintain with the support of some other people around you.
Love it, love it, love it. So I hear that we have some highly motivated. I have a couple of highly motivated people in here. So I did a scale from 1 to 3. How motivated are you? And I'm getting a couple of 3s. Now, I will tell you, I'm still cycling, right? And depending on where I am in my menstrual cycle, depends on how motivated I am. So I might go down to, for the most part, I'm on 3, but sometimes I might go down to a 1. How can people that care about you, that love you, recognize that your motivation level is low, that you may be having that sadness, depression, anxiety? How do you recommend that the people in the community help people that are demotivated or less motivated?
That's a great question. And I think it's so important for us, especially when it comes to things like stress and our health and wellness, is to make sure that we keep an eye on the people next to us. And so I encourage you, if you see, your friend, your sister, looking a little more disheveled maybe, or not even as extreme, they're just not reaching out to you as much. Don't assume that they have an issue with you or they want to be alone. You reach out, you check on them, you say, hey, how are things going? And if you don't already have that established, accountability kind of partnership, then you might introduce it. You might say, I've noticed that you haven't really been reaching out as much. Do you want to go on a walk? Right. And then that's how you might open that conversation. Or do you want to go on a Zoom if they're not as close by? So making sure that you are caring for the people in your circle, keeping an eye, and that might be a coworker too, right? It can be anyone, and reaching out to them and giving them grace, right? Don't assume the worst. And I think that's been important for me in my life when people, reach out to me and I'm like, oh, wow, they care about me. And it gives me that motivation because I see that they see me and they want better for me.
So we had a great question from one of our Viva lifers, asked, how do I find a good therapist in my area?
That is a great question. So there's a lot of different ways to find a good therapist. I'm going to put some examples of here in the chat. So there's therapyforblackgirls.com that has therapists in your area if you're looking for a Black therapist. There's helloalma.com. I'll put them in a minute. And that website has, thank you, Hello Alma. That website has therapists that take insurance. And then there's also psychologytoday.com, and you can use the filters on that website to find different therapists who are focusing in on specific needs that you might have. Let's say it's ADHD, stress, that sort of thing. You can do the filters there. And there's also therapyforblackboys.com, if I remember correctly. I'll triple check that. So there's different websites that can cater if you're looking for sort of a more culturally competent therapist.
Oh, I love that. I love that because I get questions all the time on, how do I find a therapist? And remember, your therapist can be a psychologist. Psychiatry typically is associated with giving you meds while, doing some therapy. They can be a licensed clinical social worker. They could be a marriage and family therapist. So there's a lot, and it can be your primary care doctor, can be your OBGYN, if you're just trying to open up the conversation and, start with the conversation there. And sometimes your primary care and your OBGYN are the ones that are going to start you on medications if needed as well. So those are all options for you as well there. Alrighty, let's see.
And I'll drop it's actually therapyforblackmen.org. I just found it.
Therapy for
I'll
Black
drop
men.
it in there.
Okay, sounds good. Thank you so much. All right. Can you just review for us again the 4 tips that you have for us and maybe put up that QR code again for us?
Sure. I will pull up the QR code. The first one, again, is pausing and reflecting. And again, that's just making sure that you're taking stock of where you are. We are go, 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 go. And sometimes we need to slow, 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 slow so that we can make sure that we are focusing in on us. The other tip, here we go. So you can see the QR code. The other tip is setting that SMART goal. So something that is specific, measurable, attainable, relevant, and time-bound. And then finding an accountability partner. It might be somebody in this webinar. It might be, somebody in your home or your friend, and that person will help continue to coach you and keep you accountable. And then finally, giving yourself grace. You fall off the wagon, jump back on, and know that just because you had a little bit of hiccup, that doesn't mean it isn't a lesson that you might be learning, or that doesn't mean you can't jump back on and go forward again.
Have any other questions for Dr. Gregory? I do see a 2 here as far as a motivation. So I'm really excited that you came in and talked to us about this. The other thing is we did have a prior discussion about grace and giving yourself grace. And I think, your number 4 tip was grace. So I'm just so excited. We did not go over this, this presentation, y'all. This is not canned and it's not planned.
It was not planned. I'm loving the alignment.
Yes, so it is definitely aligned. So we want to thank you from the bottom of our hearts for being on with us, for continuing to be in the primary care space. We know it is not easy. We know that you all are, the front door to our healthcare, and we truly appreciate all the hard work that you put in, especially in our health equity space as well, because you are taking on 2 really, really big jobs. And the fact that you are doing it for everybody, but we know that you're also doing it for us. So we appreciate that. That being said, y'all, go ahead and get the links for everything that we're doing. I'll send those out to you again. When we send you out the survey, please go ahead and give us a response on how we're doing, what we can do better, and what you want to see in the future as well. Dr. Gregory and I are going to stand back while you guys sign off. So have a wonderful day. And don't forget to do what? Viva life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva life.